Welcome, everybody. My name is Magali De Castro, and I'm with Bayside Medicare Local. Today, we'll be presenting an introduction to the Practice Coaching website. Now, the Practice Coaching initiative is an initiative of Bayside Medicare Local. The idea of this initiative is to allow clinics to register for free online training for both clinical staff and admin staff. And then the areas of training that are included at the moment on the website specifically on chronic disease. So that would be looking at chronic disease initiatives and activities like care plans, as an example, as well as health promotion activities and initiatives. So that would be, as an example, health assessments. So to give you a bit of an overview, we'll just start with the reason this came to be is we actually had a practice coaching initiative that was essentially like an intensive version of practice support, working very closely with clinics that had a high burden of chronic disease to look at ways of sustainably enhance the systems in those clinics. So this is where this tool, the website, is essentially a tool to distribute the resources that we use and the training that we use to make it available to all clinics. A great advantage of this is obviously if you're in a clinic, you are and you're a practice manager or you're a practice nurse. Oftentimes, if you get somebody from the Medicare Local to come out and give you a presentation or do a training session, it's not usual that you'll be able to get all the staff members to attend at the one time. So that's why it's a good idea to have an initiative such as the Practice Coaching website, where this training is available 24/7, and staff members can actually do it. And this is both clinical and admin staff can actually undertake this training wherever they have internet access. So I'll start by giving you an overview. So the website is www.practicecoaching.com.au. It's important that you type the www in, because sometimes, depending on the browser that you're using, if you're using a browser that's defaulting to Bing as a search engine, it can often do all sorts of weird things. So just make sure that whenever you put this address, that you type www.practicecoaching.com.au. You'll end up in this site, and this is essentially your what we call your welcome page, and it's got a little bit of information about the two main sections inside the platform. And if you keep scrolling down, you'll see that it's also including links to other training that we've developed. So there's a training to help clinics with GP student placement. So there's some resources and some interviews with practice managers, GPs, and nurses about hosting student placements. And there's also a training on cold chain management. So that's for vaccine fridges. But that's just as an aside, so that you know that you can also access those training workshops or courses from here. All right. So the first thing that we'll do is, I'm assuming that for a lot of clinics, this is going to be your first time. You're not currently registered. So I'm going to show you how to register your clinic. You would just click on this sign in or register button, which will take you to this page. On this page, there's a video that gives you an overview of what the platform is or what the website is and the kind of things that you can do in it. But here, if you already have your username and password, this is where you would enter it. So once you've registered, this is the quicker way of gaining access. But for now, say if we haven't registered, we're going to click here on this register button, which is for new accounts for either a GP clinic or independent practitioners. So I'll click here, and we're going to create an account of a fictional account. So we'll create an account for myself. So I'm just going to select a username. So this can be whatever you like. So I'm just going to put magali.decastro, which is my name. First name is Magali. Last name is De Castro. And when we're signing up or when we're registering from this screen, this is actually going to be the admin person, or the person that has the overall, that's sort of the overall admin privileges. So it's going to be overlooking this account. So this should be the person that will manage this on behalf of the clinic. So here you would select what your profession is. So because I'm part of a Medicare Local, well, actually I'll say nurse because I'm a nurse. Organization name, this is where you put the name of your clinic. If you're not associated with a clinic, if you're an independent practitioner, or if you're a nurse that's not currently working in any one practice, you can just put NA for not applicable. But for now, I'll put Bayside Medicare Local. And then you just enter your email. at bml.org.au, and you select a password. Very important that you write down somewhere where what this password is. A tip could be you could decide to use maybe your initials and a phone number. So some clinics will use the initials of the key person that's registering plus the clinic phone number, or obviously whatever other password that you're comfortable with. So I'm just going to select a random password. And then once we've got that, we click on register. Once we've registered, we land on this home page inside the platform where you'll see that we have access to a chronic disease module here, or the chronic disease section, and the health promotion section. You also have access to these two sections from this top menu. You'll see that you can at any point click on chronic disease and it'll take you to the chronic disease area, or on health promotion and it'll take you to the health promotion area. For now, let's explore the chronic disease area. So I'm just going to click on this. And we end up landing in the area that we call My Activities. This My Activities section is a bit of a summary of your progress or your clinic's progress. This website includes has a couple of features. One of them is an audit, or what we call a self-audit. This is essentially a checklist that a practice can go through to check and see if there's any gaps in the systems, or check and see if there might be any specific training needs. So this My Activities area is already prompting you to start by completing the practice self-audit, which takes approximately 35 minutes. So you want to make sure that when you want to start doing it, you put some time aside so you can concentrate and go through it. It's not mandatory. It's obviously recommended, but it's not mandatory. You can actually just jump straight into the training, which you can access at any time from the training library here. So you also have on this page, you'll be able to track the progress of your training. So you see it says training progress, it says your progress, and you have here, these are the different sections of training. And in here, you'll have a percentage that tracks how far along those sections you have completed. If at the moment, obviously, it's showing 0 because we haven't started any training, you can jump to any of this training, as I said, without doing the audit from here. Just click on any of these start buttons and it'll take you to that section. Now, I did want to show you a little bit of the audit tool so that you see what it looks like. So if we click on the audit tool, you'll see that it's a series of questions that essentially is an assessment of different areas of your practice and how your practice is approaching chronic disease activities. And obviously, if you're in the health promotion area, it'll be about health promotion activities. The only 3 options that you have for any one question is either a yes, a Y, clicking on the section under Y for yes, or clicking on the P if the answer is partially or sometimes, or clicking on the answer for N if the answer is no or not sure. So as an example, let's say that in these sections we are going through and we're maybe discussing this with the team and finding out what areas we actually are currently doing versus partially or sometimes doing versus never or not sure if we're doing. If we need to leave this halfway through at any point, we can. We just have to make sure that we save and exit. So you see here that there's a save and exit button that would allow you to save a partially completed assessment to come back at another time. So that can be quite handy, obviously, if you get interrupted, if something happens in the clinic and you have to all of a sudden leave and you don't think that you'll be able to get back to this in the meantime. So if I go back into My Activities, which is remembering our summary area, it'll now keep track of my audit tool, and it'll say that it's actually at the moment 8% complete. So at any point I can go back, click on continue, and resume my self-audit. Let's have a look at the training library. So if I wanted to jump on the training, I can click on this training library at any point. And then here we have the different sections of training. So you don't have to do it in any particular order. You can do it in the order that is suggested, but you don't have to. You might decide that, in your clinic, maybe, the practice nurses believe that patient-centered care might be the priority, so they might decide to start there. Just for simplicity's sake, I'm just going to start with the first one, which is practice vision for chronic disease. Click on enter. And with each one of the training sections, you'll have different topics. So with these topics, if you click on it, it'll expand and it'll give you access to a video, any supporting resources to download, and a mini quiz that just means that you get to reflect on the content that you've learned. And it's also the way that when we complete these mini quizzes, that's the way that the platform knows that you're completing or that you're watching the videos and that's all taking place. So that's how it's going to be able to then track your progress. So with this, we would just click on the play button and we'd watch the video. I'm not going to click on it at this stage, just for the sake of showing you through. With the mini quiz, say I've answered one of these questions, say I answered incorrectly and I say submit, it'll just give me a prompt that answer is incorrect. And then, I might try a couple of other times and eventually I'll get a correct answer. So when this happens, we still have another section here to complete for this area. And again, we'd watch this video, we can download any of the resources that are relevant, and then complete the mini quiz. Okay. So once this has been complete, you can go back to your training library to then explore, okay, well, what other topic can I do? You'll see that now something has changed. This section 1 that where we would have watched those 2 videos and completed those 2 mini quizzes has now turned green. And that's because it's detecting it as completed. You've completed that section. You can go in again by clicking revisit, or you can also print a certificate for this section. This is a fantastic resource to have for accreditation, because if you can get your staff members to log on and go through some of these sections, and they don't have to go through all of them, but even just some of them, and print certificates for those sections that they complete, then you can keep that as evidence of in-house training and also as evidence of continuous quality improvement. Okay, so again, we would just go into another training section from here. I'll show you also there's a resources library. So if I click on here, this is essentially the list of all of the downloads that are available throughout the different modules, but all in the one place. So it's just a quick way of accessing, I remember I saw a template that I wanted to use, but I can't remember which section it was in. You can find it here in the resources because they're all compiled here. If I go back into My Activities, which remember the My Activities button was our summary area, you'll see that it still says that my audit is only 8% complete, so I can continue it here. But you'll now notice that this is tracking my progress with the training. So it says for practice vision for chronic disease, this section is now completed 100%, and I can actually print my certificate again from here. Now, if we add new staff members, you'll be able to track progress for each staff member individually. How do we do that? We would just go into, remember, you have to be the admin, the person who signed up or who registered the clinic, so you would have the admin privileges to do this. Under the Home tab, we would go over here to the left and click on My Profile. And My Profile just has obviously all the details of your clinic and all the details that you entered. If you need to modify any of this, you can just click on Edit, and then it'll allow you to modify this. If I want to add more staff members so that I can track them because they're all part of my clinic, then you can click here on Add Individual, and it'll again prompt me to give them a username. So say it's my fellow coworker Jane Smith. So I'm just going to write Jane Smith. That's going to be her username. Her name is Jane. Her last name is Smith. And she's a nurse. I would put her email here. And whatever password we decide. And then we create an account. Oh, oh, no way, the Jane Smith already exists, so I'm gonna have to use somebody else. Maybe I'll use John Smith, and so which is a male nurse that we have here. Create account. Okay, so what you'll see is now if I scroll down, we've added John Smith over here, and we'll actually now be able to track their progress. Where do we track their progress? Again, if I go back into my chronic disease area, and I scroll down, I still have the same information, but now it's also tracking John Smith. So if I want to see how John Smith is going along, I click on him, and it'll show me here his progress when he starts obviously going through the different training modules. So this is how I would add multiple staff members, so that each one, when they're completing it, they can track their own progress, they can do it at their own pace, and when they print certificates, obviously the certificates have their name on it and not someone else's. If we wanted to access the health promotion section, what you'll notice is we'll click on health promotion. And the layout is exactly the same. You have the My Activities area, the audit. This audit is going to be specific to health promotion activities. You have the training library, which again, this training is more specifically geared towards health promotion activities, and the resources. And the layout you'll see here is exactly the same. It starts by suggesting that you do the audit, which, remember, it's optional, but it's something that we would highly recommend. And then here you can track your progress. Obviously, we haven't done any of the health promotion modules, so they're all sitting at 0%. And here we can track John Smith, who will also be sitting at 0% at the moment. Okay. The great thing about completing the audit tool is if you go through that, it'll actually, based on your results, it'll change the recommendations here. So it'll actually put recommended training, the areas where your clinic had gaps, and then optional training will be all the other areas where your clinic might have done quite well, but obviously you still may have providers or staff members who want to access that information. So that is an overview of the practice coaching website. I'm happy to now take some questions if there's any questions. I'll just have a quick look and see what questions are coming through. Okay, so one of the questions that came through is from Michelle. She says, I think this is great for clinical staff, but would this be good for receptionists to do some of this? The answer is yes, definitely. There's several of these. I'm going to go back into the training library to show you. Several of these modules, these training modules, are actually very much appropriate, very appropriate for practice staff, so your admin staff. So the area of practice vision for health promotion, or the same for practice vision for chronic disease care, that first section is a great idea to get as many staff members of the clinic as possible, because it is about starting a conversation of what do we want to achieve, how do we want to run these initiatives. Same with role allocation, especially for admin staff who might have a slightly more managerial role, so either practice managers or admin staff who are more senior admin support. Then also things like practice systems, so this section 5, which very much talks about the way that we would invite patients, recruit patients, promote different activities. Also the collaboration with other providers, because obviously a lot of reception staff are going to be involved with faxing referrals, sending, trying to coordinate booking appointments for patients and things like that. So that's another area that could be quite useful for them. And then also supporting services, so becoming aware of what other, for example, community services are available that we could recommend or refer patients to. So that's that question. Another question from Vanessa. It says, I missed the beginning, so I'm just wondering, I know that this is being recorded, how will we be able to access this recording? and how do we access from different computers. So the recording of this session will be available on the Bayside Medicare Local website, but it'll also be available. We'll add a frequently asked question page to our practice coaching website, so you'll actually be able to find it on this site as well. When you give different staff members their unique username and password, they're actually able to access the website with their credentials from any internet enabled device. So either from their computer at home or from even their mobile phone. So this has actually been made to be compatible with mobile phones and to be compatible with tablets. So if you want to watch it on your iPhone, your iPad, or whatever other device you have, you can also do it that way. If you have any questions, the best people to talk to help you through this, if you've got any issues with registering your clinic, or you're not quite sure how to add staff members, or you've forgotten your password and you need to reset it, or if you need any other kind of support, feel free to contact the Bayside Medicare Local Practice Support Team. So that would either be myself, so Magali, or Kate or Rebecca, and we'd be more than happy to support you with that. We've got one more question here. So there's a question about is this website useful as a useful tool for allied health staff? And the answer is yes, it could be. So it depends on how allied health will probably really gain a lot from the chronic disease module, especially if they're involved with chronic disease Medicare plans. So if they take chronic disease Medicare patients to give them rebates under the chronic disease scheme. So they will definitely benefit from some of the sections. If your allied health staff is involved, obviously if you're quite integrated into the clinic, it would be a great idea to have them be part of the conversation about the practice vision for the clinic, and also to get them to have a look at the collaborating with other providers, because it obviously talks a fair bit about communication between allied health and the general practice team, but also between just essentially all the multidisciplinary points of care. It might also be useful for them to look at supporting services and to be aware of, well, if I've got a patient and I'm not quite sure, they've got issues that are now falling outside of my scope. This could give them a bit of an overview of how to go about finding out what your network could be, or how to support the clinic to create a solid network that we can refer patients to, or also that we can get peer support from. So that's about it for our content. If there's no other questions, I don't see any other hands raised. Thank you very much for your time. My name again is Magali De Castro, and feel free to give us a call if you need support. The phone number for the Bayside Medicare Local is 8514-1000. Again, that's 8514-1000, or you can look up our website, bml.org.au. Thank you very much.